On a claim, a diagnostic code can be assigned to a procedure and submitted on a claim to an insurance payer. The United States will transition from ICD-9 to ICD-10 diagnostic code set. The rule requires all HIPAA-covered entities to use the new ICD-10 code set as of October 1, 2015. Diagnostic codes are submitted on claims for procedures to support the reason for the treatment. The feature is useful for the dentist to assign a diagnostic code to a procedure and submit on a claim. To add a diagnosis code, go to DAISY, Configure, List Maintenance. In the Simple List tab, select Diagnosis Codes in the drop-down menu. To add a new code, right-click on the grid and select New Item. In the Diagnosis Code field, enter the new diagnosis code, such as M27.53. Click on the description field and enter endodontic underfill. Click Save. Open the claim that you want to assign diagnosis codes to procedures. Click on the Diagnoses tab. There are two areas to enter information in the Diagnoses window: the diagnosis code and assigning the code to a procedure. The user can choose to assign the diagnosis code field to the procedure first, or to select the diagnosis code, then assign it to the procedure. To enter the diagnosis code, click the magnifying glass and the diagnosis codes from List Maintenance will display. Select the code M27.53 endodontic underfill. Click OK. Continue to select diagnosis codes that apply to the procedures on the claim. To assign the diagnosis code to a procedure, select the checkbox that points to the correct diagnosis code for the procedure. Multiple diagnosis codes can be selected for a single procedure. Select checkbox A to assign the diagnosis code M27.53 to procedure D3347 for retreatment of previous root canal therapy. Select checkbox B to assign K05.6 to procedure D4910 for periodontal maintenance. You can also add a second diagnosis code to the procedure by selecting checkbox C for E11.630, type 2 diabetes with periodontal disease. Click Save. If the date of service is on September 30th, 2015 or earlier, the claim form will indicate the diagnosis code as an ICD-9. If the date of service is on October 1st, 2015 or later, then it will indicate that an ICD-10 code is being used. This can be seen on the ADA 2012 dental claim form in box 34. It can also be seen on the CMS 1500 medical claim form in box 21. Now you know how to add a new diagnosis code and to assign them to procedures on a claim. Thank you for choosing DAISY. If you have any questions, please call us at 1-800-368-6401.